Massive cuts to Medicaid are part of President Trump's big, beautiful budget bill. After months of denials, Republican lawmakers releasing their plan to pay for tax cuts by slashing Medicaid funding by more than 80% for millions of low-income and disabled Americans. Now, some Republicans already saying they plan to vote down that budget bill. Speaker Johnson is hoping to pass this to the president in less than 2 weeks.
Hands off Medicaid. That's the rallying cry of healthcare workers, patients, and Democratic lawmakers hoping a Republican-proposed $715 billion cut from the critical healthcare service does not move forward.
So the potential impacts will be that we will have layoffs, we will have cuts, we will have potential closures of clinics and services for the community, which are completely underserved anyway at this time.
People will die earlier, no doubt about it. And the inequities in our healthcare system, the differences between the rich and the poor will only get wider.
Roughly 40% of Californians rely on Medicaid, and many patients say it's their lifeline covering things like medicine, wheelchairs, and costly surgeries.
It's not just about losing a program. It's about losing the very resources that allow us to live.
They need it.
The line that they're giving about these big cuts to Medicaid is that there are work requirements, that there's too many able-bodied people laying around getting free health care. We believe welfare dependency, not work, is the barrier. That's an op-ed from Robert F. Kennedy Jr., Mehmet Oz. What do you say to that?
It's nonsense. The overwhelming, we're going to be looking at $715 billion in cuts to Medicaid and to the Affordable Care Act. That means, Chris, that according to the CBO, over 13 million Americans are going to lose their health insurance. And then on top of that, what the Republicans are proposing is a $35 co-payment for many Medicaid recipients.
Right.
If you are making $16,000 a year, you know what? You can't afford that $35. You are not going to go to the doctor. One of the outrageous dysfunctionalities of our current healthcare system is we lose some 70,000 people a year die because they don't get to a doctor on time. When you throw 13 million people off of health insurance, when you raise co-payments for poor people, it is a death sentence. Thousands and thousands of low-income and working people will die because they simply will not be able to get into a doctor's office when they need it.